Hello everyone. Today's topic is diabetes insipidus. Diabetes insipidus. So today's topic is diabetes insipidus. So at first we learn about the introduction, next definition. Here the introduction definition are mixed. Like diabetes insipidus is uncommon condition. It is not a common, okay? So that's why it's called uncommon. That's occur when kidney are unable to conserve water. It means that when the kidney can't store the water as they perform their function of filtering the blood, okay? At first, kidney unable to conserve the water. Then next, they perform their function of filtering the blood. So the kidney doesn't filter the blood because the kidney unable to conserve the water. Okay. I hope this is clear to all. Next, the amount of water conserved is controlled by ADH is called the vasopressin. So the amount of water conserved is controlled. So the kidney also conserve the water, and this is controlled by ADH. ADH means antidiuretic hormone, which has another name. This is a vasopressin also. Even the ADH secretes from our brain. This is hypothalamus, okay, and this is a part of the posterior pituitary. Okay, I hope this is clear. Next, ADH produced in the region of brain called hypothalamus, the posterior pituitary. Okay. Next, function of ADH. Regulate the level of water in body by controlling the amount of urine that kidney produce. What's the function of antidiuretic hormone? It's also regulate the water in the body. It means that it controls of the water level. Okay. It has a control of water level and controlling the amount of urine that the kidney produce. Water develops ADH, pituitary release ADH to conserve the water, stop the production of the urine. Water level, when the water level drops, okay. Next, pituitary conserve the water and the stop of production of the urine. So, two most common symptom of diabetes mellitus. Two common symptom, what is that? That is excessive and prolonged thirst, passing the large amount of urine and needing to urinate frequently. Left untreated, severe dehydration, shock and death. Okay. So the common symptom means excessive thirst. Thirst means polydipsia. Okay. Polydipsia is the medical term. It means excessive thirst means your body wants more water. Okay. Your body wants to intake more water than the body requirement. Okay. So the excessive thirst present, prolonged and passing frequent urination also present here. Frequent urination with diluted urine means it's concentrated also. It has a more concentration. Okay, so that is called a diluted urine. Needing to urinate frequently. If it is untreated, if you are not going, if you are thinking that is normal, you are not treated it properly by a doctor, then it can be fatal also. It can be also life-threatening. Like severe dehydration also present. As a symptom also, and shock and death. So here we present that diabetes mellitus is a rare medical disease condition. Okay, here the two P's present. Polyuria means frequent urination and also diluted urine present, also polydipsia. So I also said that polydipsia means excessive thirst. Your body wants to intake more water. Okay, so excessive excretion of diluted urine, increased of deficiency ADH, posterior pituitary vasopressin thrust. What's the funda? The funda of this disease, diabetes insipidus, that your ADH means it secretes from the posterior pituitary, which is in the hypothalamus also. The function of the kidney is totally disbalanced. When the kidney unable to conserve the water, then ADH act on this. Okay, তখনই কাজ করে। দেখো, the type of the diabetes insipidus, central diabetes insipidus. Okay, damage, disrupt normal production, storage and release of the ADH. So hypothalamus secrete inadequate ADH. When the hypothalamus secrete inadequate ADH, then this happens. Is inadequate response of ADH to plasma osmolarity. When hypothalamus secretes inadequate ADH, okay, is a inadequate response of ADH to plasma osmolarity. Damage to pituitary gland or hypothalamus, most commonly due to the cranial surgery. Hypothalamic pituitary tumor, thrombosis, head injury, skull fracture and immunologic disorder. Okay, next, nephrogenic diabetes insipidus can be genetic, chronic and it can cause by medication. Okay, in a long time you took many medicine like which affects on the kidney and which damage the function of the kidney, then it affects also. Okay, so let's see. Sickle cell anemia, kidney fails to respond ADH, inadequate renal response to ADH, defect in the renal tubules that causes water to be excreted and reabsorbed. Cardiovascular disorder include the pyelonephritis, polycystic disease. Polycystic disease means PCOS and PCOD. This is the most common cases in our generation because this is a lifestyle disorder. I also said in some video also that this is a lifestyle disorder and it can causes the fatal condition if left untreated. If you are not treating this condition, then you will going to die in future. Okay, because in the polycystic ovarian disease, you should have faced some difficulties in your body function, in your reproductive system, everything affected. Okay, you see that you notice that your hairs are too much falling. Okay, yes, so intrinsic renal disease and certain drugs like lithium, tetracycline and anesthetics, the dimethylcycline, methoxyfluorine. Okay, next হচ্ছে psychogenic diabetes insipidus. I noted this from some references book of my college. Okay, of my college library hours. I also doing this kind of things. So psychogenic diabetes insipidus is abnormality, genetic and medication, extreme large fluid intake which may be idiopathic or related to the psychosis or the sarcoidosis. In case excessive fluid intake leads to suppression of ADH. Drinking too much liquid can be result of abnormal thrust, can caused by damage to the thrust regulating mechanism situated in hypothalamus. Gestational diabetes insipidus occurs during pregnancy when enzyme made by placenta, the system of blood vessels and other tissue that allows the exchange of the nutrients and waste product between the mother and her baby destroy ADH in mother. Okay, as I explained this case also, there's a gestational diabetes insipidus. It seems only the pregnant woman. Okay, a enzyme which is present in placenta. Okay, the system of blood vessels and the tissue allow the exchange of nutrient. Okay, The placenta, it is connected. It is a connection mother and baby. Okay, it is a channel. You can say this is a channel or the tube-like. Placenta is a tube-like or the channel-like thing which connect between mother and baby, and from mother nutrients and some oxygen, even the waste product also comes from baby to mother, and the nutrients, oxygen also goes from mother to baby through this placenta. Okay, so this is an exchange channel. Okay, so in this case it's also destroy the ADH of mother. So pathophysiology means what is the root cause, and you have to explain in this pathophysiology by step to step. Okay, due to etiological factor, at first decrease ADH synthesis means our hypothalamus can't do properly, so it doesn't synthesize the ADH in a adequate manner or adequate level also. Next, water absorption in renal tubule. Okay, decrease the intravascular fluid volume, increase serum osmolarity, excessive urine output, severe dehydration, hypovolemic shock. It leads to, okay, it leads to hypovolemic shock. Next, etiology. What is the etiology and what is the cause? Etiology means cause and clinical manifestation means sign and symptom. What is the root cause? Okay, here is present the 3P and 3D. Diabetes insipidus we are learning now. What is the 3P? 3P means poor concentrated urine, polyuria, polydipsia. Poor concentrated urine means the concentration, I also said in the dilute concentration, sorry for giving the wrong information. That is the poor concentrated means the concentrate is less than normal range. Okay, urine. This is only for urine. This polyuria means frequent urination and excessive thirst, polydipsia. And 3D means drowsiness, headache, like your body can't permit do anything. Okay, you need to sleep, you need to headache some. Okay, dehydration and dry skin. Next, kidney damage, head trauma, genetic defect, brain infection, drug induced, lithium, demiclosilin, medication, kidney failure. In children, irritability, slower than expected growth, high body temperature, vomiting, loss of appetite, fatigue, unexplained weight loss, diarrhea also present. Next, we come into the clinical manifestation or the sign and symptom. Polyuria, nocturia means in the night time the frequent urination present. Okay. Next, polydipsia. Polydipsia also said that excessive thirst, 16 to 20 liter per day. You need to take a water. Okay. A normal person should take a water only 5 liter in a day. Per day you have to take 5 liter. For adult, for old age person, anyone. Okay. Next, diluted urine, bedwetting for children, dehydration, dry lips, skin, frequent urination, mild 2.5 liter, severe 15 liter, hyperthermia, high serum osmolarity, severe weakness, fatigue, altered mental status, weight loss, constipation, poor turgor, shock, coma, cardiovascular. I will explain the particular area where the clinical manifestation sign symptom are seen. Okay. Next, cardiovascular, hypotension, tachycardia, hypovolemic shock. When our body leads to a severe dehydration, then it causes hypovolemic shock. Means your body doesn't have the adequate water. Okay. So neurological weakness, restlessness, fatigue, headache, seizure, coma, changes level of consciousness, visual disturbance due to dehydration and the electrolyte balance. GI system, dehydration, weight loss, constipation, loss of appetite, abdominal fullness. Anorexia, weight loss due to the consciousness fluid consumption, sunken eyes, dry skin, lip. Diagnostic evaluation, urine test, specific gravity, urine test, urine analysis korte hobe, you have to check the specific gravity of urine, osmolarity level of urine and the sodium level which is present in a urine. ADH test, this is a must. And also desmopressin test, CT scan and MRI. Please comment in the below that what is the full form of CT scan and MRI. Okay, this is your task. So, water deprivation test. Patient will be asked to stop drinking fluid 2 or 3 hours before the test, so doctor can measure the changes of body weight. Okay, water deprivation test means before 2 or 3 hours, okay, the doctor or the healthcare or the nurse says that you have to stop to drink water before the test, okay, and 2 to 3 hours. Next, the test also completed. Then the doctor, by this test, the doctor also check the body weight, monitor the body weight. Okay. Next, antidiuretic hormone test and urine analysis. Water excreted high, salt, waste concentrated is low. Physical chemical examination of urine. Urine is less concentrated, it can be diabetes insipidus. MRI, magnetic resonance imaging. And MRI of the head is non-invasive. Produce that uses a powerful magnet and radio wave to construct the detailed picture of the brain tissue. MRI abnormalities in or near pituitary gland. Okay, medical management, CDI. Okay, at first low salt diet, low protein salt, vasopressin, desmopressin, non-steroid যেটা আর কি non-steroid anti-inflammatory drug you have to use as per doctor prescribed. If your doctor is prescribed the medicine, you have to take in per day or the doctor's order. Okay. Next, endometrial thiazide diuretics. Nursing management, person now should do for the proper care of the patient. At first, check the blood pressure, check the skin turgor, vital sign, blood test, serum, sodium level, osmolality, check the intake output chart, sunken eyes, avoid caffeine, provide adequate fluid, provide education to patient and family regarding this disease condition, and it helps to improve the condition of the patient, and even also the patient and the family came to know about this disease condition and they also be aware to prevent the disease. Okay, next, monitoring the level of dehydration, skin turgor, fluid status, administration, vasopressin, monitoring complications such as shock, hypovolemic shock, complication, coma, seizures, potassium level is getting high, severe dehydration. I also said in this video before. Let's see, the increase the level of the potassium, it is called hyperkalemia. What is called hyperkalemia? Even it's low, then called the hypokalemia. Even in the case of sodium is increased or increase of the sodium level, this is called the hypernatremia. Okay, even also the decrease of the sodium, it is called the hyponatremia. Okay, water deprivation test, also said ADH test, and the diagnostic evaluation, history collection, physical examination, polyuria dehydration, polydipsia, water deprivation test, urine specific gravity. So that is for today. If you like this video, if you think that this video is helpful for all of you, please like, comment and share. Don't forget to subscribe my channel, and I will give the most beautiful video in my channel. Okay, thank you for supporting me. Thanks.